Hello, we are Group 8. We are going to talk about graft versus host disease.
Graft versus host disease (GVHD) is a condition that might occur after an allogeneic hematopoietic stem cell transplant. Allogeneic transplants use healthy blood stem cells from a donor to replace bone marrow that's not producing enough healthy blood cells. Bone marrow transplant is one of allogeneic hematopoietic stem cell transplants. After transplant, GVHD can occur. GVHD can also occur after a transfusion. GVHD is one of typical complications of allogeneic transplant and can be mild, moderate, or severe. In some cases, it can be life-threatening. GVHD occurs when the donor's T cells in the donated stem cells or bone marrow view the patient's healthy cells as different and attack and damage them. Normally, T cells don't attack our own cells because they recognize proteins on the cells called HLA. HLA is unique to each person. After allogeneic transplant, there are new blood cells from the donor's stem cells, and the new blood cells have the donor's HLA pattern. They recognize the HLA pattern of the patient as different and may begin to attack the patient's cells. As mentioned above, GVHD occurs when the donor's T cells see the patient's cells as different and attack and damage them. On the other hand, transplant rejection occurs when the patient's T cells see the donor's tissues or organs as different and attack and damage them. Compared to GVHD, the aggressor and the aggressor are opposite in transplant rejection.
There are two categories of GVHD, acute GVHD and chronic GVHD. Acute GVHD usually develops within the first 100 days after transplantation. Acute GVHD can affect skin rash with burning and redness, or the gastrointestinal, nausea, vomiting, diarrhea, or the liver, jaundice. Chronic GVHD may involve a single organ or several organs, for example, skin rash, thickening or tightening skin, dry eyes, very dry mouth, mouth pain, or sensitivity to spicy food, shortness of breath and difficulty breathing. There are treatments to reduce the risk of GVHD. One is getting the best donor match. GVHD can develop when the donor and the patient have a different type of HLA. So the closer the donor's HLA type is to the patient, the lower the risk of GVHD. The other is giving the patient preventive medicine to suppress the immune system. Treatment for GVHD depends on type of GVHD and symptom. There are several treatments, but the main treatment is steroid medicine and immunosuppressant to reduce the patient's immune response. This is a systematic therapy. In addition to this therapy, patients can often be treated with topical therapies. For example, skin GVHD may be treated with steroid ointment, and cases of ocular GVHD may be treated with immunosuppressive eye drops.